Right, thank you very much. Good evening, everybody, and welcome to you all. First of all, I would like to welcome the leader of the council, Councillor Stephen Alambritus, and I will ask him to say a few words later after the minutes of the meeting. And thank you to all other councillors who are here tonight. Thank you for your interest in the matter, and also welcome all the speakers and people who are going to do the presentation. We start with, are there any declarations of interest? No. Agenda item number 2, any apologies for absence? None.
There might be an apology from Mr. Sheikh. He said if he couldn't get access, then we should put him down as an apology for the evening.
Okay, thank you. And agenda item number 3, minutes of the last meeting, we had 7 pages of it. Can we take the minutes as accepted? And can I also ask that if there are any matters arising from the minutes? None?
Accepted.
Right. And I just wanted to say before we start, before I ask the leader of the council to speak, that we're going to swap agenda item number 5 to be the last item on Black Lives Matters. And after agenda number 4, we'll take agenda item number 6. Okay? I'll ask the leader of the council to say a few words. Councillor Stephen Alambritus.
So just before that, can I just interject? Can I ask everyone who's not speaking to please mute their mics?
I think they all,
there are a couple that are not muted. Okay. Thank you.
Thank you, Edith, and thank you to the Joint Consultative Committee with ethnic minority organisations. And first, thank you to all the organisations, all the participants, and to you, Edith, for your chairing of this crucial committee. I'm delighted to be here tonight, and I'm sorry that I was not at your last meeting. Merton stands united against all forms of hate, and that is something that is going through all the work that we do here at the London Borough of Merton. Now, the core of Merton's values is a commitment to tackling inequality, and that is what we do day in, day out, and we want to strive to a situation where there is fairness, there is no discrimination, and no hate at all here in the London Borough of Merton. On every residential independent survey we undertake of residents, they feel happy and they feel that they are not discriminated against, but we do know that there is discrimination. We do know that there are issues, and that is why this committee is very important in guiding the council, in talking to us, in us listening to you, to make sure there is not one iota of discrimination or inequality in this borough of London. We are acutely aware, and you'll be listening to Rachel Wardell, our Director for Children, Schools and Families, about the Council's work on Black Lives Matters, and you'll be acutely aware of the disproportionate impact of COVID-19 on the BAME community, and that is again at the core of our work as we move forward in tackling this pandemic. So that's all I wanted to say. Just a big thank you for all your hard work, day in, day out, over the years. I know how hard you work, and I'm here in a listening mode, and hopefully we'll be able to contribute. I'm pleased that there are councillors from all parties here. The Conservatives are represented, the Liberal Democrats are represented, and so is the Labour Party. We are all together in supporting the JCC tonight. Thank you, and I'm looking forward to the meeting.
Right, thank you very much, Councillor Stephen Alambritus. You know, we're very happy to hear your kind words. We now move on to agenda item number 4, Merton COVID-19 Community Response Hub, and Heather Begg, the business process lead for LBM, is going to lead us into this. Heather, can I ask you to do the presentation?
Many thank you, Councillor Macaulay. So yes, my name's Heather Begg. I worked in adult social care as a commissioner, and we have commissioned the Community Response Hub. If you could just go back to the previous slide, that would be great. we're going very quickly. So if you can go back to the previous slide, please, Stella, that'd be lovely. Lovely, thank you. So yes, we set this response hub up in partnership with a number of organisations in March very quickly. So actually on the day of lockdown, the Community Response Hub went live. We're one of the first in the country actually to do that. And that's because we had such a good partnership arrangement with our voluntary sector. And so since March, we have been supporting people with shopping and basic supplies, volunteer shoppers, advice and practical help to stay independent, stay active, help for those people self-isolating and shielding with access to prescriptions and medicines, and also telephone befriending. So those numbers that you see there, the email address and the phone line, they've been the same numbers since March. And what we did in July is that we commissioned this service for 3 months to the end of September, but it will be extended for a further 3 months to the end of December. So just wanted to really advertise the Community Response Hub here today at the JCC to ensure that people know we are very much there to support people who are self-isolating, maybe previously shielding, vulnerable, isolated residents in Merton. We're here to help. Next slide, please. So these are just some of the numbers. I'm not going to go too much in detail, but you can see that we have been able to support a large number of people. We've also worked very closely in partnership with other community organisations, such as the Don's Local Action Group, the food banks, Merton Mutual Aid, and wider partnerships with a number of organisations across Merton. We were able to support people very quickly if they needed help. And if people still need help, so there have been people phoning up today, the Community Response Hub, who've needed support with emergency food parcels. Maybe they've just been discharged from hospital and they need some support. We're there to support them. Also, if people are going in for a planned procedure and they need to self-isolate, again, we are there to help them. So if you can just move on to the next slide, Stella, please. Okay, so this is an ongoing partnership delivery model that is led by Age UK Merton, Wimbledon Guild and Merton Voluntary Service Council. However, it's not just those 3 organisations that are involved in this. This is very much a partnership with a number of organisations, and some of those organisations are on the call today. And it provides a centralised point for residents seeking help. It's simple, 1 number, 1 email address. And we can provide an enhanced and rapid response for all borough residents. And we can link residents to other services and support in the borough. The simplicity of the Community Response Hub is that actually, if hospitals have been sending people letters for planned procedures where they've needed to maybe self-isolate for a couple of weeks before that procedure, and that person doesn't have anyone to support them, that the number of the Community Response Hub is on that letter and people can phone up, and they are doing so as well. So there's 3 tiers of support that people get. So they'll get the immediate information and advice. Then tier 2 is around practical support, whether that's a volunteer shopper or a befriender. And also people's longer term needs are supported, looking at sustainable options for people to support them around maybe their shopping and provision needs. And we're also responding to a lot of queries. We were responding to it as queries about people who were shielding, but obviously now shielding has paused, but people are still choosing to self-isolate and shield for very good reasons. And as I said before, we're supporting hospital admission, prehabilitation and discharge. And I know Barry Causer from Public Health is also going to be talking this evening about the local outbreak control plan, and that's something we're very much involved in. So why I'm here today is we're seeking to promote the service more widely. As I said, I attended a community engagement event on the 11th of August, and there was a couple of people on that call who was in my breakout group who didn't know about the Community Response Hub. So despite what we think we did a large marketing campaign, we're still not reaching everybody. So what we've done is we've taken a step back and we've really considered what else we need to do. And that's why we really need the help of the JCC. And so I'm going to go on to another slide in a second about what we need your help with. So if you can just go to the next slide, Stella. This is very busy, this slide, so I don't imagine any of you will be able to see all of this. But really what this is trying to show and demonstrate is the wide range of support that somebody can access if they phone the Community Response Hub. So one number, we just get some basic information, a basic assessment of what people need support with. If there are any immediate needs, we get that dealt with. So say, for example, somebody needed an emergency food parcel. If they phone in the morning, they can get that parcel in the afternoon. And if they need advice or any support with navigation and onward referrals, we can do that. We're also referring for a variety of different support regarding food and provisions, mental and emotional health, and this is really, really prevalent now. We are finding a lot more people needing a lot more emotional support. Things are getting hard, things are tough for people, particularly people who are isolated and have been shielding or self-isolating for a long time. So we're seeing the demand for befriending going up quite a lot. Physical health, how people can keep themselves active. Any advice, legal and financial, this is particularly going to be so important going forward. We're all very concerned about what's going to happen in the autumn. And so we need to make sure that support and advice is there for people. And also to support people to remain safe, feel confident and independent in their own home. Okay, next slide, please. Lovely. We're also working with a Merton Volunteer Service Council, MVSC, to ensure that we develop the hub. So it's not just a contact, it's not just a call centre, but it's much more richer than that, and it can respond to the needs of our local communities. So we're always making sure that we have volunteering capability going forward. And right from the word go, we've been engaging with Merton Mutual Aid, which I know some of you are very involved on this call today, and other community networks as well. We're linking really strongly with social prescribing, and also are very encouraged to be working alongside community champions. And I know they had their inaugural meeting this week. So, you know, we're very excited about that. We're also looking at the developing community fridge network and working with local food banks. And we're coming together as a community response, whether somebody is vulnerable and isolated and needs support, or whether somebody is struggling financially and needs support. That can all come to the hub, and we can then disseminate to the appropriate organisation. We are looking for new partners to join our community fridge food network. So if you are interested in talking to me a little bit more about that, then please do so. And I'm sure we can share my contact details. We're also using the information that we get from the hub activity to really understand, you know, and evidence what the future model needs to look like, or not. It may be that when it's not needed, but I think listening to the news over the last couple of days, you know, I think we're going to be here to stay for a while. And also making sure that, so MVSC also help to provide intelligence for the community-based action. So we are able to flex and change in according to what the need and demand is locally. Next slide, please, Stella. Okay, so this is over to you. So really, we've got some ideas ourselves about future partnership working with all communities in Merton, and we have been trying to be very proactive about engaging with certain communities. For example, we've gone through everybody on the MVSC directory in terms of organisations, but communicating with the faith and belief establishments. But we're looking wider than that as well. So it'd be really good to hear some other people's ideas on that and ideas for future engagement as well. How do we reach out to make sure that if people need the support of the Community Response Hub, they can get it? And also, we want the JCC to help communicate what this service is, what the Community Response Hub offer is to the wider community. So then we can really strengthen our referral pathways and ensure that we are a hub for everybody. Okay, so I think that's it from me. If anyone's got any questions, I hope I haven't gone too long over time. Councillor Annan Brittas, I can see you waving.
Yes, thank you very much for that, Heather. And I'm so pleased that our hub was one of the first to be set up. And you have indeed mentioned a mutual aid group, primarily based in Wimbledon, and you referred to other community networks. But I do think, if you'll allow me to name some of those, because it really is important that they are mentioned in this meeting. And I've been to a number of these. So Common Side in Pollard's Hill, over 100 food recipients every week. Fridays are very busy there, and I've been there and I've seen the good work that they do. And they recently set up a fresh food bank, reaching approximately 50 food recipients a week. And access to fresh food is very, very important. Elim Pentecostal Church runs the Wimbledon Food Bank, and we're so pleased with all the work that they're doing. And I was actually coincidentally speaking to Father John Featherstone there about their excellent work. And in this area where all community organisations need to come to the fore, and you can't get bigger than a local football club, AFC Wimbledon through the Dons Local Action Group have really reached out and massively worked throughout the borough and have achieved major national media recognition that has made on the map. They've also done a program called Kids Connected. As we know, children who are not going to school were connecting through iPads, mobiles, but there are children who are deprived, who are from very poor backgrounds, who don't have that capacity. And I wanted to mention our local Member of Parliament, Siobhan McDonough, and the work of Stephen Hammond as well in Wimbledon. Siobhan in particular has been big on free school meals and throughout the lockdown, and on getting kids connected with iPads and phones. And also the AFC Wimbledon have done a youth centre work at Phibbs Bridge as well. So that is all very good. I want to thank you, Heather, and MVSC and Simon Shimin, all the work they're doing. We're all very, very proud of you. Thank you.
Right. Thank you very much, Heather. We have seen from the presentation the brilliant work which you and your team perform for the community in the last few months, and we are very proud of what you're doing. And obviously, I will like to, on behalf of the JCC and also councillors who are here present tonight, to thank you for all your work. And I invite anyone who wishes to speak to unmute themselves, and you're only allowed to speak for 3 minutes and no more, so that we give everybody a chance. If I can't see you and I can't see your name on the chat, can you please, just shout your name so you can speak? Does anybody want to ask any questions?
Jocelyn?
Yes, go on then.
Can you hear me?
Yes.
Oh yeah. So I was just looking through the slide and thought how the community engagement and how that works. One of the things as a resident here, I kind of don't see or have any communication around this work, and how is that communicated to residents? For example, just around the COVID period and the George Floyd, those two things stand out for me, and I just wanted to know.
Sorry, I have to interpret. I was thinking to make some suggestion or comment on the presentation by Hedda.
Right, hold on, Mr. Islam. Can you just hold on? I'll call. We're going to take 3 people at a time.
Yeah.
Have you finished, Joycelyn?
Hello, Chair, Madam Chair.
Yeah. I just wanted to know how
hold on, Mr. Islam.
Yes. I just want to add because I have to go, and that's why I'm making this. The work that is at the moment is what is called going on. I think it should be more strengthened, and we should be involved much, particularly the health-related issues is very, very important for this COVID, and the GP surgery should give more facilities for the patient and other things, because it should be anything, if there is risky, it should be stopped at the very beginning, not to hang it for a long time. And that's why I think it is very important. It is impressive what Hedda has said, but at the same time, I think the combined work and the community work, including all the active organizations, should be strengthened. And that's what I feel, and that's my comment. Okay.
Okay, thank you, Mr. Islam.
Thank you.
Any more speaker? One more to go.
Okay.
See you.
Thank you, Chair.
Right. Okay. Heather, do you want to reply? Okay, Mr. Copeland. Sorry, Mr. Copeland.
I wanted to ask if you could just say a little bit more about how the mental health issues are being responded to through the community response. That it is a significant issue across communities and very topical in the news as well.
Okay, thank you, Mr. Copeland. Do you want to respond to those 3?
Yeah, absolutely, Councillor Macaulay. So in terms of what Jocelyn has said, Jocelyn, what we're doing is we're sending posters. Sorry, we're sending, we've got an article in My Merton, so that's gone to every household. I saw Councillor Alan Brittis holding it up earlier. So on page 6, this is the, so on My Merton, we've got page 6. We've got an article here with the number, and that's been in the last 2 My Mertons as well. Now, obviously, not everyone's going to read My Merton, so we've made sure that there's posters in any community organisation, GP practice, health service. We've sent out to all faith and belief organisations, but posters aren't enough. It's about having conversations and constructive conversations. And that's what we've realized that we need to do a lot more of. So we've started that, we're starting doing that. And we'll be very encouraged to talk with people at this meeting today and have conversations with you. And we want to go be a bit more creative and really reach out. So looking at culturally appropriate supermarkets, barbers, hairdressers, lots of other community areas where people go, and talking with them to really promote, to ensure that people know that there is help out there if people need that. We know, as Councillor Aaron Brittis said, there's an awful lot of organisations that are doing an amazing job that we're really strongly linked into. In fact, I have a meeting with John Featherstone from the Food Bank and Naomi Martin together on Thursday morning to look at our next steps to make sure we're ready if there is an increase in demand. So I hope, Jocelyn, that answers some of your question in terms of we are communicating out to make sure people do have that number. And what I'm recommending to people is cut it out, stick it on your fridge, you know, so people know if, you know, they've got that number to hand. in terms of the other question, we are wanting to raise awareness and engage. So please do take my details. Someone said they've never received my Merton since lockdown, so I think we'd have to look into that. But yes, it does tend to go to most households. Bishop Copeland, in terms of your response, you were saying about the mental health, and I'm really encouraged by some of the work that you're looking to do going forward and are doing already. We do have some fact sheets that we put together to support the Community Response Hub, because what we realised is as lockdown happened, lots of people weren't able to update their websites or keep up with the communication. So we actually developed 8 fact sheets to go alongside the community response. One of those fact sheets has all of the local offer regarding services for people's mental health and well-being. And we've got quite a comprehensive list of the wider offer. What we're also looking at now as well is volunteers have been providing some fantastic support, and it's been so encouraging to see so many more volunteers, people who'd never volunteered before but really stepped up to the challenge of COVID, which was amazing. But actually we are wanting to make sure that those volunteers receive support as well, because some of the conversations they're having with people, they're difficult conversations, so we're wanting to make sure that there is training and support and supervision for them as well. So I know I've glossed over a little bit, but I'd be very happy to share that information with you, Bishop, if that's okay. There are some things on the chat. Would you like me to respond, Councillor Macaulay, or would you?
Yes, just briefly.
Yep, so sorry, I'm just having a little quick glance through. Okay, so that's more about the Black Lives Matter, Jocelyn. So I think that's going to be addressed later on in the agenda, isn't it?
Yeah.
Yeah, and there's somebody who represents a modern Islamic centre, and that would be absolutely fantastic. I think we've left a couple of messages for you. I would love to have a conversation with the Modern Islamic Centre. You do some amazing stuff in terms of adult social care. We're often referring people to you because we share a building with you. So very much, I would love to get your contact details. Maybe ever if you can connect us after this meeting.
Yeah, I can do that.
Lovely, thank you.
Right, there's somebody. Yeah.
Hi,
right.
sorry.
Thank you, Heather. There's
Hi.
somebody.
Yeah, would I be able to just echo Stephen Allen-Brittis's comments and thank Heather for all the hard work she's been doing and all the hard work that's kind of been done across the borough over the past couple of months, which I think has kind of been seen by us all on this chat today. Kind of tying into the last comment from the Modern Islamic Centre, are you, obviously with places of worship now open again and it being a hub for people to visit and a hub for people to kind of communicate, is it something whereby you're kind of making contact with those faith groups to spread the good word and spread the good efforts that you're obviously doing, so then it can kind of be shared amongst more people, and more people can obviously benefit from the great work that you are already undertaking?
Absolutely. Right. This is very much a network. It's a partnership approach. It's a team effort. So it's a team across a range of different organisations and communities in Merton for this to work. And very much so, we are really keen to engage with the wider faith and belief network. So we've already sent information out to organisations, but again, as I said before, it's more about that face-to-face, having a conversation, and you know, really promoting that relationship.
Thank you, Heather. I think I'll just take one more speaker, Naveed from the Modern Islamic Community. Do you want to say something, Naveed?
Yeah, thanks, Edith. I think my question's been answered. I just wanted to try and understand how we can connect a bit more in terms of getting involved with the hub. So we already partner with many of the schools in Merton and the council themselves. and we partner with Sainsbury's in Morden. So if we can help and be involved in the hub, we've been delivering many packages for the last few months over the lockdown period. So would love to get involved with you.
Yeah.
To me.
And we would love actually for you to be a community fridge partner as well.
Yeah, definitely.
So,
if you can get in contact with me and connect, and we can get that sorted out.
Yeah,
no
love to. I'll send my details in the chat. Okay.
Thank you very much.
Right.
Thanks, Naveed.
Thank you very much. I think, Heather, I think we've done very well on this item. We're going to move on to the next item, which I mentioned before. That's going to be agenda item number 6. And it's going to be on the local outbreak control plan by Barry Koza, who's a public health commissioner manager, followed by Nick Stevens, head of regulatory services partnership. Can I have Barry first, please?
Good evening. Thank you, Councillor. My name is Barry Causa. I'm the Head of Strategic Commissioning in the Merton Public Health team. I'm really pleased to be with you all this evening. So if you go to the next slide for me, please. The aim and purpose of the time I have with you tonight is really to build on the conversation that you had with our Director of Public Health, Dr. Dagmar Zuna, just a few months ago. So I'm going to give you a brief update on the COVID impact on Merton communities so far. I'm not going to dwell too long on the data. I'm going to give you a brief overview of outbreak control and prevention, which builds on the stuff that you've already heard from Heather about the community hub. And then really importantly, I'm going to talk about those important messages for community involvement and action, and then how we can work together going forward. And as the Chair said, I'm one part of a double act tonight, then I'll hand over to Nick Stevens. Next slide, please, Stella. You may remember this slide from the previous presentation by Dr. Dagmar Zuna, or you might have taken part in some of the community workshops. What this slide shows us is the number of lab-confirmed COVID-19 positive cases in Merton. So the number that you can see at the bottom there, 1,027, is the number of positive cases across NHS and in the community. So this takes us from the data sources from the 1st of September there. And the orange vertical lines are showing us the number of cases each day as lab confirmed cases. And what you can see is the distinctive shape of that curve. So with that peak in around the kind of the 4th of April time. What you can see on the right hand side of that slide is the most recent dates. They seem to have dropped off the slide there. But we have seen an increase in number of cases recently. We're getting small numbers each day, 2s, 3s, 4s, but we are seeing an increase. And what the blue line across the top shows is the cumulative number of cases within Merton. Okay. And I think what's really important is that I'm showing you one slide and one data point there. What I can say is that Merton Council, our public health team, and colleagues, as well as Public Health England, look at the data every single day, every single week. And we look at a range of different data points. Clearly, what I'm showing you there is the number of positive cases. We also look at the number of tests that have been taken. We also look at the positivity rates of those tests. We look at hospital data, and we also look at the 7-day rate per 100,000 residents, and also the number of cases and contacts completed by the test and trace service. So what I'm saying is that there are a number of different data points that we look at on a regular basis. And all of that information and data feeds in through the structure, so into the Merton Outbreak Control Group. So Nick and I sit on that Outbreak Control Group, and that's chaired by Dagmar Zuna and Kath James. And so it's really important that cases are slowly creeping up, okay? But we are not on watch lists. We are not near the rates required for that at this stage. And so I'm really pleased that the timing is right for me to have this conversation about community impact and how we can work really closely together. Next slide, please. You may recognise this slide from before when Dagmar presented this. This is an incredibly sad slide. This shows us the number of deaths registered by Merton residents. And you can see in the top right-hand corner of that slide that there had, to the data points there on the 28th of August, there have been 205 deaths of Merton residents for COVID-related reasons. What I can tell you is that when Dagmar spoke to you previously, the number was 197. So in those few months it's gone up by 8. I'm not going to dwell too much longer on that, but each of those is incredibly sad. But again, looking at the right-hand side of that, you can see the very small numbers, the number of zeros there. And so the number of deaths is very small within Merton at the moment. Next slide, please. I'm going to talk about outbreak control. So within Merton, like many other local authorities, we published a plan on outbreak control. We published this on the 1st of July, and it's accessible at the link. Have a look at the link. It's an interesting plan. It sets out what we're going to do to keep us all safe. The purpose of the plan is to really complement the NHS test and trace to minimise virus spread. We identify high-risk settings, vulnerable communities, and it really describes how we within Merton Council work with our colleagues in the NHS, the voluntary sector, and of course Public Health England. Important about the outbreak control plan is the scope. The scope is very much about managing and preventing COVID-19 outbreaks. This is not about recovery right now. There are other work streams within the council and within Merton that deal with recovery. So thinking about the themes of the outbreak control plan, the sort of things that we look at every day, every week. We look at care homes. So our adult social care team work very, very hard to protect care homes. We have regular contact with the care homes to understand. And also schools. Schools went back this week. My children went back to school this week. They went in with smiley faces. They were really pleased to be back. The teachers were welcoming them back. And again, us working through outbreak control, working closely with our CSF colleagues to make sure that schools are safe. We look at other high-risk settings, whether that be transport hubs or large community centres, for example. We look at testing. We look about local contact tracing and case finding, and we look at vulnerable people. Timeline for outbreak control, it's in place now. We meet on every week, and the plan is initially in place to the end of March. Really importantly, I think we're getting prepared for what could be a particularly challenging autumn and winter period. It starts to get a bit colder. It starts to start raining, no doubt, and we spend more time indoors. Okay, we have coughs and splutters, so that's the period of time that we're looking at for that plan. Have a look at it. I'm happy to have a conversation with anybody about how we can get more ideas to support the Merton residents. Next slide, please. And then we get on to community action. This is a really important part of this. We have a plan, that's great, and it's a good plan, and it protects our communities and our vulnerable people, but we need to work with the community. And there's nothing on this slide or the next one that you haven't seen before. We've heard in the press today, cases are going up, and what's going to be important to protect ourselves, our families, and our communities. This is our toolbox to fight COVID-19. I am going to go through them, and this is about regular hand washing. This is about social distancing, and I think social distancing as well as on public transport, within the workplace, within the environment, within families, when you're going out to our fantastic pubs and restaurants within Merton, and wearing face coverings. These are really important things. These help protect the community, and your support to get those messages out will be appreciated. Again, symptoms to look for: high temperature, new continuous cough, loss or change of smell or taste. So these are the things. Soon as if you get symptoms, request a test. Again, I have to talk about testing, lots in the press. There has been challenges in accessing testing. This has been flagged through our outbreak control group and Dagmar in the networks that she works to increase testing. We've been told that testing will improve. What I would say is I've already had a number of emails and telephone calls over the last few days. If you struggle to get through to the testing site or it sends you to somewhere far away, that's because all the slots at that time have been taken up. Keep trying. Additional slots are being made available throughout the day, so please continue to try that. NHS Test and Trace. I've mentioned this before. This is the service that really does protect us, as well as that individual and community action around hand washing, social distancing. Test and Trace. So if you have a positive test, you'll be contacted by Test and Trace and asked for contact details of any close contacts. Please do so. It helps protect us. This is one of our preventive services. And if you're contacted by Test and Trace, having been a close contact of someone, and they ask you to self-isolate, please do so again. Again, if you're concerned about being able to access medicines or food, and there's other reasons that you feel that you can't self-isolate, we have the community hub. It's there to help support all of us to be able to do these things. The final message really on community action is around, unfortunately, fraud. And that we haven't seen particularly an increase in fraud on this within Merton, but I'm just making you aware of it because, again, it's how we protect our communities and vulnerable people. It sounds quite plausible. You might get a phone call from someone pretending to be Test and Trace. They might say, oh, Barry, you've been in contact with someone. I can arrange a test for you. It's all free. The NHS pays for that. But what I do need is I need your bank details. And that's just so I can send the postage. I can charge you for the postage to get your test. This is not true. That is fraud. And so the test and delivery is free of charge. Okay, this is really important. And again, the text messages will come from NHS tracing and the calls come from that number. And we're developing comms and communications on how we can get those messages out to the community as well. Next slide, please. This next slide is about the community action for reducing the health impact. Dagmar spoke previously about the disproportionate impact on particular communities within Merton. And to reduce that health impact of COVID, it's really important. And there might be, I don't think there's any clinical colleagues on. The NHS is open. If you are worried, please go to your phone your GP or use NHS 111. They are there to help us. Also, the message we're working on through at the moment is around COVID fit, to get COVID fit. All of us can get COVID fit to reduce the risk of severe COVID-19 or complications. What that essentially means is to eat well or lose weight, be more physically active, stop smoking. And again, thinking about those three kind of lifestyle factors or behaviours, we have good quality commissioned services within Merton to be able to support you to lose weight, eat well, be active, and to stop smoking. Again, thinking about getting COVID fit, reducing the risk of severe COVID, manage long-term conditions. We're working closely with the NHS, with our GP colleagues, so that anyone with diabetes might be invited in for a review. So again, this is the time to get our long-term conditions under control. And we've done a huge amount of work on diabetes led by the Health and Wellbeing Board within Merton previously. So we've got a good foundation to be able to tackle that. Excuse me. Next bit on community action for reducing health impact. Get your flu jab, please. I'd encourage everyone to get their flu jab. Many groups get this free. It's recently been extended so that more groups can access this funded by the NHS. If not, your employer might provide a free flu jab for you. And if not, you can certainly get one from a local community pharmacies who will be able to help you for perhaps 10, 11, 12 pounds. If you've never had a flu jab before, I would encourage you to get one this year. And we've heard already about mental health and wellbeing. This is really important. We've spoken about preventing severe COVID. We've spoken about the physical health. Mental health and wellbeing is going to be absolutely important. It's been tricky. I've been speaking to many of our community and residents. It's been really difficult, hasn't it? It's been really difficult for all of us. But again, we have those services to be able to support people's mental health and well-being. We've got the Merton Uplift service, and we've got Good Thinking in case you wanted to use those digital services. And I'm feeding through the comments and the things that I hear about mental health to the Mental Health Programme Board, which is meeting on Thursday, led by the local CCG. Next slide, please. Last slide from me. How to get involved. I think it's really important. Local outbreak control plan is about working with the community. We've heard already about the fantastic networks we've got. We've got the Dons, we've got Mutual Aid, we've got the thriving voluntary sector, and we've got really good partnerships. We need to build on that. So what I'd encourage you to do is to take part in our Health and Wellbeing Board-led qualitative research programme. So we're having an initial focus on BAME, older people, young people, learning disabilities and carers. So again, we want to have conversations with those groups to be able to help us to support to get the messages out to our vulnerable people. We held, I think Heather mentioned it earlier, a community engagement workshop on the 11th of August with 53 people in attendance. We've got another one tomorrow. We're going to delve a little bit deeper on some of the things, and we want to listen to the community. So that's taking place tomorrow at 12 till 2. So again, if you want to participate tomorrow, welcome your input there. My details, you can email me. And we're also working very closely with Hannah Neal and BAME Voice on their resilience program. So again, you're increasingly going to be seeing more information from that. So I'm really pleased to be able to talk about that this evening. Excuse me. Last bit, the network of COVID community champions. I'm delighted to see probably about 5, 6 or 7 people attending tonight that attended our community champions kickoff meeting last week. We had 2 meetings, one at the daytime, one at 7 p.m. We had 62 local people that wanted to participate in a network of community champions. We're going to grow it over time. I would love to spend more time with you to talk through how we can work together on this. And essentially what this is about, there was a question earlier to Heather about how we get the reach. And we get the reach through My Merton, social media, Facebook, and all those different things. But we also get it face to face and through those trusted local leaders and community contacts and leaders. Those community champions have been made up of a wonderful group of people. We have residents, we've got a whole bunch of councillors, we've got service providers, we've got council officers, we've got CCG officers, voluntary sector representatives, we've got GPs, residents associations, Health Watch and more. So you can see we've got a starting point of a network to really help get the messages out about outbreak control and mitigating that health harm. Final point for me really is to, and I think Heather said exactly the same thing, let us know your ideas on how we can keep Merton safe. I will speak to anybody. I will speak to all of you individually if I have to. It's really not a problem. We need to work with the community to tackle COVID-19. And I'd like to thank you for listening tonight. And Chair, I don't know if you wanted to go over to Nick Stevens straight away or whether you want...
Yes, I think we'll go to Nick straight away. Yeah.
Thank you, Chair.
Thank you very much, Councillor McCordy. Thank you, Barry. Stella, is it okay if I present my screen? Is that possible?
Yeah, I'll stop presenting and then you can do it. You want to do your own presentation?
It's just cleaner on some of the transitions, if that's okay.
Yeah.
Lovely. Firstly, thank you very much for inviting me along. I'm here with my colleague, Robin Rahman, who is the Food and Safety Manager for the Regulatory Services Partnership. So really what we wanted to do this evening was talk to you about what the RSP does, what the work we've done during the pandemic, and most importantly, just to flag how you can raise concerns if you have a particular issue with COVID-19 or a lack of preparations or precautions within a business in relation to COVID-19 during the pandemic. So we'll start at the beginning if we can. What the Regulatory Services Partnership does. So the RSP, as we shorten it to for obvious reasons, covers 3 boroughs. It covers Merton, and Merton is the host authority. So all of the officers that work in the RSP are appointed and employed by Merton, and predominantly located within the civic offices in Morden. We also cover the boroughs of Richmond and Wandsworth. And we provide a variety of regulatory services on behalf of those 3 authorities. They range from air quality and contaminated land work. We also deal with food safety. So anywhere that offers food for sale, we are responsible for inspecting and enforcing it. We also cover things like health and safety. So Barry made reference to residential care homes. Councillor Alan Brittis also made reference to AFC Wimbledon. We enforce health and safety in those premises and many more, including commercial catering establishments and retail premises. So with AFC Wimbledon, we are working with them to provide them with a safety certificate once everything is as it should be and it's completely constructed. And in residential care, we deal with the food hygiene and the health and safety. We also deal with licensing, whether that be for beauty premises, the sale of alcohol, regulated entertainment, and lots of other things in between, like markets, pavement licenses, and gambling. In 2 of the boroughs, but not Merton, we cover private sector housing. So we'll look at things like disrepair and houses in multiple occupation. We also cover noise and nuisance, whether that be neighbour noise or commercial noise, and anything from odours through to pest infestations also comes under our remit. And one of the things that's been referenced by Barry during his presentation was around COVID fraud. We cover a service called Trading Standards, and that covers a variety of things from misdescription, age-related sales, counterfeit goods, and providing advice to consumers on anything to do with sales. So that's a very short summary of what the RSP offers for Merton and for you as residents. During the pandemic, we've managed to deliver that as part of our business as usual, but also we've been heavily involved in some other elements. As part of Robin's food work within the food and safety team, we've historically always investigated foodborne illness, so food poisoning typically, and norovirus and other such foodborne viruses. So our expertise lends itself very, very well to working with Dagmar Zuna, the Director of Public Health, Barry Causa and other services when we're trying to control the spread of a pandemic. And we do that in a number of ways. So initially when the lockdown started on the 23rd of March, we were responsible for ensuring that the non-essential premises were closed. So anything that didn't effectively sell food either needs to change its business model or it needed to close. So during that period, between the 23rd of March and the end of June, our officers undertook 1,500 compliance checks within Merton alone. That is a huge amount of work to make sure that the businesses that should be closed because it wasn't safe for them to open when the pandemic was at its peak, closed. And obviously those that were allowed to open, such as your essential retailers, your supermarkets and your food stores, were allowed to stay open, subject to having appropriate controls in place. We also provided business support, so where businesses had inquiries or members of the public had concerns about a business, as whether it should be open or whether it was trading safely, we undertook over 500 visits and advice consultations to support the public and those businesses. We've undertaken a huge number of webinars. It's not 9, it's more than that now. We've also worked with Merton Chamber of Commerce and with Love Wimbledon, the BID, the Business Improvement District for Wimbledon, to make sure that businesses were supported and provided with the information that they needed. The one problem that I think businesses have found during the pandemic is some of the national guidelines can be quite vague. So interpreting them to a small business is very, very challenging. So we've been there to assist and support through that. We also provide a business champion. Maria Dane is our business champion within Merton, and she provides direct support to businesses. So you'll find her out and about on the high street, encouraging them to comply informally initially, and then doing the unpopular thing, which is taking action as and when we need to. As Barry referenced earlier on, we work as part of the Merton Outbreak Control Group. So we provide advice and support to the Director of Public Health. And our role is twofold, really. One, it's to ensure that businesses and licensed events, in fact, any public event is managed safely, but also to investigate outbreaks of COVID as and when they occur. And most recently, a lot of our focus has been on the potential for case tracing. So you'll be aware of the NHS Test, Track and Trace, as it was previously known, now known as Test and Trace. We are looking at developing a localized model for that. We recognize that the national model doesn't fit all people, doesn't fit all boroughs. So we're looking at how we can implement localized case tracing. So that will be officers within the council, the London Borough of Merton, effectively contacting residents who've tested positive for COVID, providing them with support and advice to make sure they self-isolate, to identify their cases, and also pointing them towards support mechanisms such as the community fridges. So in terms of our business involvement, we've been heavily trying to promote the COVID Secure in 2020 posters. So when you're out and about in any of the high streets, hopefully you'll be able to see these posters being displayed. This should provide you with a level of confidence that they've properly assessed the risks within their business. Any business that's currently trading needs to have undertaken a COVID specific risk assessment, and that's them critically appraising their business and making sure that they've got appropriate measures in place for that business to be safe for its employees and for members of the public that set foot inside. So those procedures and that risk assessment are generally based on sector specific guidance. So there's guidance for various sectors from retail through to beauty and leisure premises. And they have to demonstrate to us as the enforcing authority they've taken all reasonable steps. And clearly you'll see in a lot of businesses, they've modified their premises, some substantially, to allow social distancing. So you would see there are meter distancing or 2 meter distancing signs, there's hand sanitization points. They'll have a limit on the number of people that can set foot inside a premises at any one time. And all of that is guided by their risk assessment. And we are there to guide them through that risk assessment process. So for customers, and I think this is the key part of the message for the JCC today, is what you can look out for as a customer. And the first thing I really need to say is, be assured the vast majority of premises are compliant. They don't necessarily have to display the poster to be compliant, but it's a really good indicator when you are out and about using the local shops. There is no reason why you should feel particularly concerned about visiting the high streets, particularly in Merton. We are very good at addressing concerns as and when they arise. So the first thing to do is look for the poster. The second thing to do as an individual is to make sure that you're following the national guidelines, including social distancing, wearing masks or face coverings inside commercial premises. Following the guidelines, so obviously if you are displaying symptoms of COVID, to make sure that you self-isolate, and the same for anyone within your household. And clearly the message that Barry gave earlier on was, please go straight to get tested. I shared in the commentary the link as to how you can register for a test. There are some concerns that the testing, the national testing service sends some people quite far afield, but we're looking to resolve that through the use of local test centres, and we are currently negotiating with the government to have at least one of those set up within the borough. So that's a local test centre in addition to the mobile testing units that you've seen up and down the country. These are smaller units that we can put into communities to be able to provide local testing. As I say, be assured that most businesses are operating safely. And I think critically, if you are concerned about a business, or you are a business owner or an employee, and you have concerns about a premises or you want advice, please contact us. There are some things that we can support you with and others that we can't. So for certain elements, so anything inside a commercial premises, is important that you report it to us, whether that be social distancing inside a shop or a retail unit, whether that be a lack of precautions in place, whether that be staff not wearing suitable PPE. And Robin will lambast me if I don't say this. We seem to be having a significant issue, particularly in barbers, hairdressers and beauty premises, with staff not wearing appropriate face coverings and visors. The guidelines are very much that, but there should be a risk assessment that informs the PPE that people, particularly in the beauty industry, should be wearing. And it's very, very clear that should be a mask and a visor because of the close proximity of that barber or beautician to the individuals that they're treating or cutting the hair of. So they should be wearing suitable PPE. If you feel there are a lack of precautions in place, a lack of personal protective equipment, or the social distancing isn't in place, for example, premises that are very crowded, please speak to us. The email address is there, rsp@merton.gov.uk. The telephone number is less memorable, so I'll make sure this is shared after the presentation this evening. And those are the kind of things we can deal with. Anything within a premises will fall to the RSP, and in the very few or infrequent circumstances that it doesn't, we'll make sure it gets referred to the relevant enforcing authority. For outside of a premises, or for the wearing of masks by customers or members of the public within an enclosed premises, that falls to the police. So it's very important that if you have concerns about groups congregating, even from large groups outside a premises or on a high street, unlicensed music events, anything like that, really that's the police. So it's important that you call 101 to register it. The police have been very clear that their resources are limited. So they take what they call the 4 E's, which is about engaging with the groups, explaining the reason why they shouldn't be congregating, encouraging them to disperse, and if necessary, then taking enforcement. And the approach to masks not being worn by the public inside publicly enclosed premises is very much the same. They will encourage individuals to wear the masks, and if they don't, then clearly they will enforce, and that can be a fixed penalty notice. And that's largely it. Anything outside of a premises, a simple rule of thumb is it would be the police through 101 to deal with. Anything inside a premises would fall to the RSP. And that is it from me. Councillor Macaulay, I'm quite happy to take any questions.
Edith, you need to unmute yourself.
So the unmuting of, sorry, I've unmuted myself. So we're very grateful for both presentation, which is quite interesting. And also, Barry, we're looking forward tomorrow to the third session of your community engagement workshop, which the public, members of the public have been very, very interested in attending. And we can see from what is being done that Merton has played a pivotal role in trying to definitely make sure that we show our residents what we're doing in terms of tackling this COVID-19, and we're doing everything possible to make sure that our residents are aware of what it's all about. We'll take questions, and if you can unmute yourself if you wish to speak. And I think I saw from the chat, Logan, you wanted to say something? Are you there? Yeah, I take Logan first, and then Councillor Omar Bush. And then Councillor Joan Henry, 3. So we'll have the 3 of them. Okay, Logan, are you there? Councillor Omar Bush, do you want to speak then?
Yeah, sure. Thank you, Councillor Macaulay. So yeah, if I could thank you both for the presentation. I found it very informative and useful to kind of find out how Merton is affected by coronavirus. So I think my question is potentially more for Barry and his initial presentation he gave. So he highlighted numbers of the COVID infection rate within Merton and the number of deaths. My question is that as a member of the BAME community who's at higher risk, do we know how those numbers are broken down for the BAME community? And are we seeing rates of infections within that community at a higher rate than the national average? And is that a cause of concern for us? And what potentially can we then do to protect that group?
Councillor Joan Henry and then Hannah Neal after that.
Thank you, Chair. I would like to thank both officers for the report and also for their great support within our community. So far, we have been doing very well. What I would like to ask for the death rate so far, a recent one, how many of those people who are healthy in proportion of those who are expecting, say for instance they were in hospital and they had some complaint that apparently it would have shortened their lifespan compared to those who just get up one morning and feeling ill and that's it.
Thank you. Hannah Neal.
Yes, I was 2 questions please, one to Barry. We've had a lot of anxious people calling us, people who live in close housing, perhaps places where, for example, asylum seekers or people who have been thrown out of their homes live. And that is that they haven't been tested. And they're very, very worried because they live very close to each other and they haven't been tested. And then I wonder whether there was anything being done about that. And the other question is to Nick. Quite a few people are asking online for these exemptions from, the COVID, from wearing the masks. Are you aware of that? And is there anything being done? Thank you.
Thank you. Do you want to answer those 3 questions first?
Thank you, everybody, for really interesting questions. To take them in order, I guess, the first one about the cases data. So yes, we are now receiving data on ethnicity where it's been provided at the point of test. So we're able to look at that information at the moment. I don't have it at my fingertips, clearly. But what I would say is that there are a number of there that we are concerned. What I would say to all communities within Merton is to follow that guidance. Socially distancing, wear face coverings where we need to. These are really important messages. And I would like to work with people in this room to be able to make sure that those messages go out. Also, tell us what the impact of COVID is. Participate in those workshops with the community so we can really understand what's going on. That lived experience is going to be really important for us to be able to protect our communities. The death rates, the Joan Henry's question, again, I'm going to have to just clarify the question with you perhaps outside about the data there. And then report back perhaps in the minutes, because I wasn't entirely clear about the full question. I hope that's okay to come back to you, Joan. And then the final question was around enclosed settings. So yeah, so local outbreak control plan has identified high risk settings across the borough, including some of those that Hannah has mentioned. As part of the outbreak control plan, we know where they are. We're having conversations and have made contact with those higher risk settings so that we can make sure that they have risk assessments in place to be able to support them and protect them. And then I'm not so sure if Nick has anything to add to those or the additional question.
No.
Yeah, thank you, Barry. In relation to the face coverings, it's very much a police matter. Clearly, if there is an exemption or there is a reason why a person isn't wearing a face covering when they're working in a premises, that would fall to us. But if it's a member of the public looking to use an exemption as a justification for not wearing a face mask, whether that be an impairment or because of age, again, that would fall to the police. So if there are particular concerns there, 101. I find it very, very frustrating. You know, we're trying to deal with a pandemic here. And as Barry alluded, the figures in Merton are good. There's nothing to be concerned about at the moment, but Barry's job, my job, and the Director of Public Health's job is to ensure that it stays that way. And we all believe very, very firmly that face coverings are a very solid solution to do that.
Could I just follow up on the response from Barry? Would you be able to, obviously, I appreciate you don't have the figures with yourself at the moment, but are you able to provide those BAME figures to me personally? Because obviously that would be of interest to me to see then what response we have in reaction to whether there is a disproportionate amount of residents that are BAME and are affected by COVID, just to see whether we're keeping up with the expected rate or exceeding that.
Yeah, absolutely. I can give you a call tomorrow, Councillor, and we can talk it through the data that we have, what's in the public domain. And again, some of the other data that we do have, it's about exceedance levels. So where it's red, where it's amber, where it's green. What I can say generally is it is green levels at the moment. But again, to unpick that ethnicity data is going to be a really important part of our approach. So I can give you a call tomorrow to talk through.
Yeah, I'll have to take that offline, Barry. Thank you.
Thank you.
Thank you. Is Jocelyn there? Jocelyn, did you want to ask a question?
Yeah, I wanted to ask about the face coverings in school. It sounds a bit, the schools are left to do what they like with our children. Is there a way to kind of just promote or say to schools, these face coverings actually help to spread, to prevent this virus from spreading? Yes, and I see the guidelines. I see there was guidance. I'm just saying that it's worrying that it's left to the discretion of the schools. There's no social distancing in the school. So if we are told to social distance when you go to the supermarket, how are we not being told in school to social distance and to wear a face covering? That's one. And two, I've asked about the tests. Is there a local testing in Merton? Thank you.
Right. Naveed, did you want to ask a further question? Are you there?
No, I don't have any questions. Thank you.
Right. Robin? Robin Raman, did you want to ask a further question? Anybody else want to ask a question?
No, I don't have a question. This is Robin Rahman speaking. I didn't have a specific question. Okay. The guidance for face coverings there. complaints regarding schools. It's very, very difficult, you know, especially at sort of closing times. It is something that the MOCOG, the Merton Outbreak Control Team, have been made aware of. And I think they are working on comms for schools. That's as much as I can say on that, I'm afraid, at the moment.
Okay, thank you. Did you want to come in on that?
Question, please.
Oh, okay, Councillor Brenda Fraser.
Thank you. Thanks, Barry and Nick. Very explicit information you've given us, except that in Merton, there are a number of multiple occupancy dwellings. And can you hear me? Because you look as if you're straining. Yeah, multiple occupancy dwellings. One is just next door to me. And I'm in Long Thornton Road. There are quite a few here. I just wonder if you have any figures on the impact of COVID-19 on any of those people and what is being done. Are you checking them, or how are we knowing what's happening, please?
Thank you, Councillor Fraser. Do you want to answer those 3 questions, please, Barry and Nick?
Yeah, maybe if I start, and maybe Nick, if you can come in to support. I guess the question about face coverings in schools, I think Robin tried to answer some of those, but the overall risk, sorry, I'll slow down. The overall risk to children related to educational settings is low. That's what the CMO is saying at this stage. Children over 12 should wear a face covering under the same conditions that we as adults wear. And it's then up to the local discretion of those head teachers and those governing bodies. And I don't know, and I think that Rachel Wardell is on the call. I don't know whether Rachel had anything specifically to say about schools to come in there. The second question was around multiple occupancy dwellings. Again, Councillor, these are mapped through the local outbreak control plan. So we have a map showing where they are, and we have contact with those to understand what the risks are. So we've mapped them, part of the plan, to understand the risks, and then we're working with those providers to mitigate those risks.
Thank you, Barry. Nick, did you want to say anything? Or is Rachel going to mention anything about the schools?
Councillor McCauley, if you want me to come in at this point, I'm happy to.
Yes, thank you.
So just to say that we have been updated regularly by the Department for Education with guidance specific to schools. We make sure that we communicate that to schools regularly. Over the summer, that was a weekly communication. Since the beginning of term, it's daily. So schools are receiving regular messages from us about what guidance applies to them and how to ensure that their children and their premises are safe. So we'll continue to work with schools, applying the requirements in relation to face masks for those children in year 7 and above, and the guidance is equally clear about younger children, but it's not an expectation in schools. That's partly, as Barry has alluded to, because of the understanding of the level of risk there, and it's also partly because if face masks are mishandled, there are other infection control risks associated with that. So very young children, it's not appropriate. But we're certainly seeing more use of face masks on school sites as a result of the revised government guidance, and we'll continue to monitor the situation. I think I saw a question emerge about how will I know if a school has an outbreak? And the answer is, if you have a child in the school and there is an outbreak in the school, then you'll be notified appropriately of any measures that the school is taking. We don't intend to particularly publish information about all our schools to all the wider Merton public, but we will ensure that children attending a school and the families of those children attending the school are notified of any relevant information. And that's, of course, vital to infection prevention and control, to make sure that any cases in school are notified appropriately.
Thank you, Rachel. Nick, do you have anything else to add onto that? No?
It was just in relation to the testing, Councillor McCauley. The testing needs to be booked through the NHS central system. That should provide you with a test location which is nearest to where you reside. That isn't always the case, and as I said earlier on, what we're trying to do is ensure that there's an increased frequency of mobile testing units within the borough. At the moment, we're looking for one that is located very close to the centre of Morden, as what's called a localized test center. And they're smaller deployable units where residents, anyone in fact, can actually walk in and have a test done quite quickly, depending on the demand at that point in time. So that's what we're trying to do to make sure that the testing is as local as it possibly can be. We're doing this in conjunction with MOCOG, and we're looking at where there are perhaps levels of greatest need in terms of testing. So perhaps where the testing within that area is already quite low or lower than it should be, or perhaps where there's an increased prevalence of cases, or actually where we feel the footfall is greater. So there would be a greater benefit for having it in a certain location. We are working very closely at the moment with Deloitte, who are locating these test centres on behalf of the government. And hopefully within the next week, we'll have some very positive news on at least one site in Merton.
Thank you. I'm taking the last 3 questions. Councillor Eloise Bailey.
Hi, thank you, Chair. My question's for Barry. It's you mentioned in your presentation about encouraging people to get the flu jab. I've been hearing in the news that there's not enough. Do we know if we have enough stocks in Merton for all the people that we are hoping to get what's the word? Vaccinated, immunized.
Right. The next question, Councillor Akijina.
Yeah, it's for Barry actually. You were going to give some statistics to Omar Bush. Do you think you can send it to us as well? If you can't ring me, that's fine. Just send it, just email me with it, and then I can discuss it with you another time. But I would like the breakdown as well.
Yeah, what I can do, I'll have that initial conversation with Councillor Bush to understand the ask, and then I can have a conversation with MOCOG to really understand what we were able to share. But absolutely, councillors, I understand the importance of this data.
Yeah. Okay.
Is there one more question? Anybody else left who wants to ask a question? No, I think we can.
Actually, Councillor Macaulay.
Yes, Bo.
Sorry, Bo's asked a question I think needs to be addressed.
Okay.
Hi, this is a question for Nick. You mentioned support to local businesses. Many of our local charities are businesses in their own right. I'm just wondering what support, if any, has been offered to our local charities in terms of readiness for reopening and keeping in compliance and being compliant.
Thanks, Bo. Sorry, I responded partially in the chat, but yes, ultimately, if it's a typical high street charity shop, we would advise and support in the same way we would any other retailer. If it's a charity that doesn't have a particular base, I would encourage them to speak to us using the RSP email address, and we'd happily help in any way we can. As I said earlier on, we've done a whole series of sector-specific webinars, from leisure to beauty to pubs, bars, restaurants, and everything in between. If you think that there's some merit in doing one purely for charitable organisations, we are more than happy to consider that.
Right. Did you answer the question from Eloise, Councillor Eloise Bailey?
Yeah, sure. That was about flu. So yes, I haven't heard anything about a lack of flu jabs within Merton. We have a flu steering group that delivers across the borough with NHS colleagues and community pharmacies. But what I do know is that it will be a staged and prioritised system. So the NHS will be prioritising those that are most in need over the flu season. So we haven't heard any lack of availability at the moment.
Right. Thank you very much for the presentation, both Barry and Nick. We're very grateful, and Barry, will see you tomorrow at the community workshop. And we now move on to agenda item number 5, Merton Council's response to Black Lives Matters, which is going to be presented by the Director of Children's Schools and Families, Rachel Waddell, and also Liz Hammond, Head of Human Resources. Rachel will be giving the issues highlighted by COVID-19 and the death of George Floyd, which have led to a challenge from our own BME staff and also residents to ask whether the council can do more to tackle injustice and racism which occurs from time to time. Thank you, Rachel.
Thank you very much for inviting me to present this paper this evening. I don't have a PowerPoint to go through, but you do have this paper in your pack, and I'm going to speak to the issues that are presented in it. So some of you will certainly remember, because you were at the 30th of June meeting, that we discussed this issue last time, and I'm really updating you on the steps that have been taken since then. So at that time, we had taken some initial steps, developing an individual risk assessment for our staff, which specifically addressed the COVID risk for our Black, Asian and other minority colleagues. We had prepared our employee assistance programme to respond appropriately to staff whose concerns encompassed injustice, experience of injustice, discrimination and racism. We had reissued the reminders to our staff about equality and diversity training. That's mandatory for all staff, and it had been refreshed. So staff were advised that is mandatory and given those appropriate reminders. And most importantly, I think, for what's coming next in the paper, we established our BAME staff forum. So there had been a staff forum of this type in the past, but it had stopped operating many years previously, and staff were very keen to see it resume at this time. And so at the time when I last spoke to you on this subject, we had just had some initial design meetings for the staff forum. That had led to a number of issues being raised, things that people wanted to see tackled quickly. And as a result, some further work has taken place since then, which I will come back to shortly. But essentially that staff forum is now established. It's tasked with, among other things, developing a medium-term strategy, and that strategy is to focus on how we improve the diversity of our staff base overall, but most particularly of our senior management team, and how we have a pipeline of BAME future leaders within the council and prioritise their development in the local government sector. In parallel with that piece of work, which is kind of internal to the council and focused on the council staff, we've also we've commissioned BAME Voice to understand the experience of our wider communities in relation to COVID-19. And you heard Barry make reference to some of this work in the earlier segment, so I don't propose to repeat everything that Barry has already told you, but undertaking that piece of work to establish what practical measures Merton's communities can make to protect themselves and each other from COVID, and enable and empower those communities to do so. So I'm really going to take you through two elements which are of this paper, which are in accordance with those two parallel pieces of work. One is about Merton as an employer, and the other is about Merton as, it's described in the paper as a leader of place. In other words, the council has a responsibility to its community to show leadership in Merton Borough across the wider community. Taking Merton as an employer first, we've committed obviously to the re-establishment of the BAME forum, and that has a direct link to the council's corporate management team, which means that those staff have an opportunity to speak directly to the most senior leaders of the council, and it's acknowledged that that body currently is all white, and as a consequence it's really important that the voices of that forum are heard there. We've committed to commissioning a programme of cross-council anti-racist education and action, and for that to be initiated from the very top, so that it can be seen that it has senior level support, to make sure that the leaders in CMT receive and appreciate that anti-racist education first, and go on to lead and ensure that other members of staff adopt it. We've taken from the forum a proposal around the NHS's workforce race equality standards, which are currently measures in the NHS to ensure that NHS organisations are protecting and acting in the interests of their BAME staff. And we have said that we will adapt those and adopt them to measure and monitor performance in a range of domains of race equality. And as I mentioned earlier, we're working up a medium-term strategy that will be in place by the end of this municipal year, and to go forward for the next 3 to 5 years, to ensure that this high level of enthusiasm and commitment at this particular point in time doesn't fade over time, but there is a staged progress over time to continue to keep these issues at the forefront of everyone's mind. So we're really focused on practical measures to increase diversity of senior leadership. There was quite a lot of challenge in last time's discussion, and rightly so, because the JCC has had this on its agenda for quite some time, and although many of the suggestions that have been put forward have been carried out, what we haven't seen is a significant change in diversity at the top. So Liz Hammond, who is the head of HR, has developed proposals to improve equalities monitoring information, so that there's a much more comprehensive picture across all areas of employment in the council. Increasing initiatives to increase the number of Black and Asian and other minority applicants applying and being shortlisted for vacancies at senior management level, and crucially increasing the AMU representation on recruitment panels, because ensuring that the people who are making the selection of senior leaders are themselves diverse increases the likelihood that we will have a diverse leadership. And following on from that, training and development for staff and consideration of reverse mentoring, leadership development programs, talent management, succession planning, and unconscious bias training. And that package of measures, you'll be pleased to know, has come forward to the corporate management team just very recently. It was before us at CMT last week. To have the first viewing of it and further work on it, because as you'll see from later on in this paper, it comes back to the council in October for agreement. So some really important measures being developed and underway there. Between now and coming back to council, those will be presented to and discussed by the BAME forum itself, so that they have input onto those measures to assess whether those measures satisfy the issues that they raised in the earlier discussions. So it's a cycle of you said, we did, how did that work for you? And then the second kind of the parallel track that I referred to is Merton as a leader of place. Again, there was much discussion about this last time we met on the 30th of June, and the kind of importance that was registered at that discussion of enabling local communities to speak for themselves, to share their lived experience, and as a result, the commissioning of BAME Voice to develop the community resilience programme to reduce the risk of infection and improve health outcomes was taken forward from that point. Now, you've heard quite a lot already from Barry and Nick about the borough's local outbreak control plan, and within that, the work that BAME Voice will be doing with the council, with the CCG, and with Merton's communities in the event of any kind of spike in infection levels in Merton. And there are a set of actions, there's 9 actions in total that are outlined for you in the paper that are being undertaken as part of this work. So a community resilience programme for people of all ages, targeting specific communities within Merton, so Bangladeshi, Pakistani, Caribbean, Sri Lankan Tamil, and communities from East, West, and Southern Africa. So those have been identified as particular communities within Merton as a whole for more focused work under this work stream. Some of the things that Barry has already mentioned around understanding impact, building resilience, identifying stigma, and reducing any structural barriers. We're looking at policies and local actions as part of this work, and the intention, and this mirrors other work that has been undertaken at different times in the past through the Health and Wellbeing Board. The intention that this work and this engagement is an intervention in its own right, so that it's actually building a network of connected community leaders. And that means that there is greater connection with support programs and with all of the other kind of measures that we have to offer. There's the crucial work with health promotion and disease prevention services, which links right back into all the work that you've just been hearing about from Barry and from Nick. There's a commitment to funding in this area. We know that small community groups have a really important role to play in tackling structural inequalities. And so we're going to change the way that we award funding through the Strategic Partner Grant Programme to try and redirect some of that funding into smaller community groups that closer target the needs of our communities, and that means closer working with the voluntary and community sector, which I hope everyone in this discussion will welcome. It's also worth mentioning that the Staff Forum has been given a small annual budget of £5,000 to enable them to engage speakers, facilitators, trainers, as and when required, and they themselves will determine how that money is distributed and accounted for in order to secure the kind of activities that they think will be most helpful. So it's a kind of self-directed fund for the BAME Forum. From my point of view, those are the headlines of this paper. As I say, a report about this work is going to the Council's Cabinet on the 12th of October, so just next month. And by that time, the measures that we had presented to us at CMT last week will have been worked through for full agreement.
Right. Liz, did you want to come in now?
Good evening, everyone. The only thing I would add to what Rachel has said in terms of where we are with the paper that I took to CMT last week is that there is a whole range of things that I have put forward as potential possibilities in how we move forward as a council. I am meeting with the BAME Forum on Monday to go through all those different initiatives with them to get their feedback so that we can together work our way forward in terms of what is going to be most useful to them, to us as an organisation, in order to move this agenda forward. So that's the only thing I wanted to add.
Thank you. Councillor Stephen Alambritis.
Thank you, Chair. Thank you, Edith. I want to thank Rachel and Liz for all the work they're doing on this very important aspect following the death of George Floyd and the evidence we all have that there is a disproportionate impact of COVID on the BAME community. I just wanted to say a few things politically for all parties, not just for mine, and that is that the Civic Centre was lit in purple in protest against George Floyd's murder, and all parties were involved in that: Conservatives, Liberal Democrats, Labour, and the Independents. We issued an all-party statement showing solidarity with our BAME community, and there was a cross-party vigil in honour of the Black Lives Movement outside the Civic Centre. You will all recall the heroic actions, brave actions of Patrick Hutchinson. Patrick is in which he protected and saved from further violence an anti-protester, someone who was protesting against him himself, and that showed the community feel and the bravery and the feeling for human kindness that Patrick Hutchinson showed. Patrick is a Croydon resident but works in Merton, and so both Merton Council and Croydon Council are working together to recognise Patrick Hutchinson's bravery in that regard. As a local Labour Party, we're working with Simon Woolley from Operation Black Vote on their back years with Operation Black Vote and with Lord Simon Woolley, who is a staunch supporter of his community and of equality and fairness within society. We as a local party as well will report to the Labour Party review and to any government review on this disproportionate impact of COVID on the BAME community. And so we'll also do the review with Doreen Lawrence, and in supporting St Helier Hospital, we've teased out that the closure of the EN, the accident emergency there, and the maternity there will actually have a disproportionate impact on the BAME community in Merton. And so we referred that matter to the Equality and Human Rights Commission. We do have a program called Bridging the Gap in the borough, and that is to see what we can do to improve the lives of our communities that are in the more deprived, more parts of our borough, and that helps everyone, including the BAME community. I know that the chair is very hardworking on Windrush and Windrush celebrations, and she has a feature in the current edition of My Merton about celebrating Windrush Day, and we always defer to Black History Month. So I just wanted to add to the BAME staff forum within the local authority. I'm very excited about getting that equality, fairness and reflection of our community within the staff here in Merton, and certainly at the senior level as well. But again, thanks for Rachel and Liz for all they're doing on this important aspect of our work. And I wanted to pay a tribute to BAME Voice and to Hannah Neal. We've had a good long conversation. I've sent a number of papers both to Edith and to Hannah, and very happy to meet. Thank you very much.
Thank you. I'll take 3 people, Hannah, Bo, and Fitzroy. Hannah first.
I wasn't aware that my hand went up, but yes, just following up from something that's been said before. I think it was Councillor Bush who wanted some information about the numbers of BAME people that have actually died. And I think that would really be important, tied up with what Rachel was saying, because quite a lot of the BAME community somehow feel stigmatized, that somehow it's our fault. And so it would be interesting to know what the actual figures are, whether they are disproportionate or not. Thank you.
Right, Bo.
Thank you, Chair. Firstly, I think we need to acknowledge that the disproportionate impact of COVID on the BAME community is not, or is merely a manifestation of the inequality, racism and discrimination that exist in society, and it's not something that is predestined within BAME individuals. So I think that needs to be a general acknowledgement. And we've seen that in the way that BAME staff have been deployed within the NHS, etc., etc., etc. Having had my little moan, one of the issues that I think Rachel, you mentioned, was the lack of BAME staff in management and senior management roles. A solution or a partial solution to that could well be looking at trusteeship and encouraging BAME staff to become trustees of local charitable organisations and voluntary sector organisations. Staff often aren't able to get into management roles because they lack managerial experience and strategic experience. Becoming a trustee of a local charity could help them gain that managerial experience and that strategic experience. It could also, so it has a double, I suppose it has a dual aspect to it, because it will also enable local charitable organisations to be strengthened, and for many local charitable organisations for their own governance and senior leadership to become more diverse. So if we look at a lot of our charities that aren't BAME charities, they tend to have a very monocultural senior leadership stroke governing body. If we could encourage staff from BAME backgrounds to take up local trusteeships, that could help with diversity there, but it will also mean that if the council were willing to look at a project of this nature, that they could allow staff volunteer days, volunteer hours to fulfill some of their, if they were to become trustee duties. I'll be happy to look at this and develop something along this line with the BAME staff forum, or indeed work with Everett Willis, because we form part of the harder to reach subgroup that the council has at the moment at how this could be taken forward.
Thank you. Fitzroy, did you want to speak?
Yeah, sorry about that, just unmuting myself.
Yeah.
My question is, well, basically I would like to thank the preparation and the organization of this particular JCC meeting. I find it very refreshing. Hadn't made any comments before because I was so involved in listening to all what's been presented, and very challenging questions in the chat. And one question I have basically is, I trying to get a feel of where it positions a lot of the individuals within the borough, individual cultures within the borough of Merton that come under the heading BAME. Obviously being Black, Caribbean, and there's obviously various multicultural structures of that Caribbean. Then African, there's a split. There's a whole vast of different parts of Africa, and not even to mention the depth and the width and the breadth of Asia. How is that reflected in the Borough of Merton, in reflection to the fact that minority ethnics and now the Ethiopians, the actual makeup in the Borough of Merton, and then that can be broken down to see where there are any issues of what aspects of those different cultures are not getting the support, because it could be that some cultures could get imbalanced support, some get none at all, but no one would ever know, because all you ever hear is the BAME, the BAME, the BAME, rather than any individuality analyzation of who within the BAME are disproportionately affected. And I don't know whether that narrative is out there or whether that can be captured in any way. Thank you.
Thank you. Can you answer those 3 questions, please?
I will take Fitzroy's first, if I may, because it's been a really important part of the discussions that we've been having. There is almost universal view that BAME or BAME is not a helpful descriptor. And we're very clear that as a name for the forum itself, it is a placeholder in a sense until that group decides how it wants to describe itself. Some of the more interesting but also challenging conversations that that the group has been having have been about how much to subdivide the conversations and to reflect very distinct cultures and identities within the group of staff that are currently brought together in that forum, and how much that fragmentation creates further difficulty in getting a kind of single voice heard, if you see what I mean. So that there's a power in the greater number when those people are all brought together. If the kind of fragmentation gets too small, then there will be lots of groups of a smaller number of individuals who may find it even more difficult to be heard. And that's proving to be a kind of a delicate interaction at the moment. So there isn't a different name yet for the forum, and there isn't a concrete agreement about how or if we will subdivide the data any further than the kind of more high-level divisions that there currently are. But there has been enough discussion around this issue to recognise those 7 communities that I alluded to earlier, which are Bangladeshi, Pakistani, Sri Lankan, Tamil, and a series of different African dimensions as well. And so some of that conversation is ongoing, and we haven't yet bottomed out what that might look like or what staff most want. What I am inferring from what's coming back from the forum is that kind of despite the wish to find a way to describe the forum and find a way to think about the different impact on different races, ethnicities and cultural groups in Merton, there is also a wish to be heard as one voice, and to get real value out of the fact that this is an issue that is making progress at the moment. So there's quite a lot of energy in the group at the moment to tackle many of these issues on the grounds that they will help everyone who is of Black, Asian and possibly other minority ethnicity to advance. So that was a bit of a convoluted answer to your question, Fitzroy, and it doesn't kind of nail it down. But I suppose you wanted to know whether that was a current discussion, and it's a very, very live discussion with no easy answers, I would say. So to go backwards through the questions, because when I get to Hannah's question, I'll have to say that I don't know the answer, but I think public health will come back to you on that. But Bo's question about, firstly, the point about disproportionate impact of COVID being a manifestation of existing inequality, and that's absolutely true. It's entirely accepted in this council, at least, and it did form part of the discussion that we had last time on the 30th of June, and that's why the range of measures that we're taking is trying to continue to tackle those areas of existing inequality, although I would acknowledge that some of them, particularly around, for example, income inequality and housing inequality, are very entrenched. But on the kind of point about senior management and trusteeship, we're absolutely open to all suggestions about how we might increase the pipeline, increase the opportunities. What we're finding, I have to say, is not that candidates lack management experience. So we've got a very diverse middle management in Merton. It's moving to the next step up, and you know, we're challenging ourselves as an organisation to say, are we the barrier? So we're not assuming actually that it's our Black, Asian and other minority candidates that need more work on them in order to succeed. We're saying to ourselves as an organisation, what are we not doing to be a welcoming organisation, to be an organisation that selects and appoints you know, a diverse range of senior candidates. So we will absolutely take that offer into our ongoing discussions, though, because I think everything helps. But we're not seeing it as a kind of that it comes from a deficit in the kind of quality or skill set of our applicants. I have to say, we're seeing it as a problem for us to solve. And just for completeness, I will say to Hannah, you were making the point about wanting to understand the number of deaths. That's not data that I have, but I think Barry heard that question loud and clear, and will come back with what data he can share.
Thank you. I've got to the next three. I'm mixing members of the public more and some councillors, because I think it's important if we hear from our communities. I'll take Mr. Copeland, then Councillor Eloise Bailey, and Grace Oriende after that.
All right, thank you for your presentation, Rachel. I wanted to ask a broader question than that, which is about this. I see the focus in terms of Merton as a council, and particularly with the workforce existing within Merton. But I'm wondering, how is that message about Black Lives Matter cascaded across wider Merton? Because those Black Lives matter too. And what is the strategy for engaging the wider communities, particularly the voluntary organizations, many of whom have a great cohort of Black members working within them, and whether there is scope to do some kind of exchange between the voluntary sector and the council to kind of promote that message, because clearly voluntary organizations need to carry that. You can't spread that message yourselves, you need other people to do that. How will you engage and broaden that so that they feel they matter, so that they can cascade that?
Thank you. Councillor Bailey.
Thank you, Chair. Rachel, I'm a bit heartened by what you've just said, because I sound like a bit of a broken record. We're always talking about if there's any scope for using name-blind applications. And before, we've kind of been told, no, they're not useful for high-level management. But you've just mentioned you're looking to increase development across all levels in our staff. So in that case, does that not open up an opportunity for using levers like name blind recruitment? Yeah, that's basically my question. And then I guess my other thing I just wanted to ask as well is in paragraph, I think it's paragraph 2.7, you mentioned that you've got initiatives to increase the number of BAME applicants applying and being shortlisted, but you don't list what those initiatives are. Could you let us know?
Yeah, Grace Oyendi.
Good evening. Thank you so much to Liz and is it Rachel? It's been very, very impressive to hear all the initiatives that you have in place. I really want to know whether we will be able to get to understand how that material will actually look like. So for example, you talked about the unconscious bias, which is one of my hot potatoes, as you know. How will that look like? And will we be able to have a look at a program of how it's going to be made up? And secondly, who will that material be delivered to? So is it just going to be to senior management? How are you going to roll out this training throughout the council? And just to take it one step further, is change can only come about through education, as we know. So how then can we then integrate this with the school system, both primary and secondary school system? How can we now integrate the unconscious bias, diversity training, and the Black history? And is there a plan to delve deeper?
Thank you, Grace. Can you take those 3 questions, Rachel, please?
Yeah, I'm going to make a start on the answers, and then I'm going to defer to Liz because some of them fall more properly into her domain. Firstly, so now I'm taking them in the original order. Wider messaging, exchange with the voluntary sector. How do we make those wider communications? I think that the second strand that I referred to, which is about Merton Council as a leader of place, starts to do that. I think that we recognise that we can't operate necessarily across all types of issue at once, and so the very pressing issue of what that looks like in the context of COVID-19 is the one that has gripped that strand at the moment, and that is the work that I referred to earlier. But I don't think it stops. I think that's an initial piece of work, and we carry on demonstrating that Black Lives Matter by showing that through the work that we do with our communities. So I think we welcome in that second strand continuing suggestions of what to do next in supporting, engaging and working with the community, either through voluntary sector organisations or directly actually in the community. So that's a kind of first stage, but by no means the end of this work. In relation to the initiatives around greater diversity, there's more available to us than name blind or recruitment, and one of the challenges that was put to us in the last conversation, you may remember, Councillor Bailey, was that the proposition that rather than disregarding race, rather than acting as though the organisation is colourblind, the expectation ought to be actually to be actively seeking diversity, actively engaging in diversity, because the attempts to create blind recruitment were always deeply flawed, in a sense, because there's always information that comes through, so you can't kind of completely remove identifying characteristics from applications, and that's why it was such a challenging problem for senior leaders recruitment, because basically the pool of candidates is small and they're largely known. But if you turn it on its head, and that was the challenge that came to us last time, and instead actively recruit for diversity, then things start to look very different, and it's a different kind of challenge. So I'll bring Liz in on that at the moment. And then there's Grace's question, which is about what the material looks like, the educational material looks like, and what the rollout is. And before I ask Liz to pick up that question as well, I will just speak briefly about the education system. So we haven't talked about it in this paper, but that's not because there isn't work happening. And I would imagine that we'll have a future JCC where we want to talk more about this. I'd be happy to bring back information about that strand, because there is active work in the school improvement team supporting our schools. So we can't, as a local authority, instruct schools in the materials they use and instruct schools in how they do this work, but we can support schools, engage schools, encourage schools, and we are absolutely undertaking that work both directly through the School Improvement Service and also through the school-led partnership, which is called Attain. And that brings together Merton schools to work together on developmental activity. So there is very much a strand there, and I'll be happy to bring back more information about that next time. So Liz, can I invite you in to say a bit more about recruitment and also about training and development?
Yeah, so thank you, Rachel. Yes, it's interesting about blind recruitment and actively recruiting for diversity, because they are actually opposite ends to one another and they contradict one another. So I think the more positive approach is to actively recruit for diversity, and that goes right back to your attraction and selection. So one of the things I want to talk to the BAME group about is how do we make ourselves a very attractive and marketable employer in the whole recruitment experience for external candidates. And we want to see that through the eyes of BAME candidates, which obviously is something that they're really going to be able to help us with. So we may think that we're appealing to all walks of life in terms of how we market ourselves and present ourselves in the media in terms of recruiting, but actually when you ask a BAME candidate, they might see things from a completely different perspective, and that's what we want to understand. So in terms of how we present ourselves out there, we will ask for their support in that. We will also ask their view on the implementation of what is commonly known as the Rooney Rule, which is where you would insist that there is a BAME candidate in your final selection for interview, and whether that is a useful initiative to have, or whether it is actually counterproductive and would be seen as paying lip service to a really important part of attracting people to Merton. So we want to get their opinion on that. Also about having BAME candidates on the recruitment panel, what benefit that brings, and how that would help us support bringing the right people into Merton. There is also a Pan-London local authority initiative going on at the moment, which I've approached Merton's staff at head of and above level, which is asking them to support from a Pan-London perspective presence on recruitment panels, mentoring and coaching. So this means that if we were actively looking for support at say a high level recruitment for Merton, and we didn't have somebody that could appropriate to sit on the panel and ensure the diversity of the panel, that we would be able to go out to a wider audience in terms of our London peers to seek that support. And obviously that would work vice versa. Our staff would also be able to support other organisations. So that's how we're looking to increase applicants. However, I would say that actually the number of applicants that we get approaching Merton for jobs at all levels does not, the stats do not reflect that we've got a particular problem. It's that final conversion at senior level from the final candidates for interview into the successful candidate, and that being a BAME individual. You've talked about unconscious bias training. So within Merton, it's our intention to roll that out across all staff, and we are also rolling out anti-racism training at initially at our leadership team, which is the sort of the top 80 managers in the organisation, as a first stop, and then we'll see how much further we need to roll that out. I also saw a question in the chat actually, which was about unions and about them being involved in our strategy. I personally meet with the unions every week on a Thursday, and they are fully engaged and up to speed with all the initiatives that we have put forward to CMT, and they're totally behind what we're trying to achieve. So we do have the union support, and they will do what they can to help us support us on our journey.
Right,
I can see that Councillor Stringer had added into the chat some of our Black Lives Matter materials from the Attain partnership I was referring to. She's faster with her clicks and links than I am, so that's in the chat if you want to look at it. Bo's asking in the chat, would it be possible to share with members statistics with regards to employees, ethnicity, department and grade? I don't think we go down to department, but we certainly do grade and things like access to training and representation in the top 5% of earners. So it seems likely that that's possible to share. And then a question about how this programme gels with the workforce strategy. So Liz, you may want to comment a little bit on this as well, but I would say this programme is now running ahead of the workforce strategy because of the energy behind it. So I think the two will in due course align again as the workforce strategy itself is renewed and updated. But at the moment, I think the initiatives under this heading are going faster than the workforce strategy is developing. Would you agree, Liz?
Yes, yeah, absolutely. I mean, obviously, it's an important part of the workforce strategy anyway in any event, but this is certainly gaining momentum at a much faster pace, and obviously, it's the priority that we're putting on it. The other thing I just would want to say about statistics is that I've proposed a very much enhanced reporting regime to CMT. And the proposal around that was some of the stats we can report on quarterly, but some of them are much better presented on an annual basis in order to ensure that we don't have double counting and that we've got enough data to have a meaningful output. Now, I have proposed that that report, once it's produced on an annual basis, would be made something that could be made available to this forum and certainly could be made a public document. So there would certainly be nothing to hide, and we would want to share our progress with people.
All right, thank you. Can I just thank Councillor Stringer for link, which is quite interesting. I've got Jocelyn, your question has been answered about the union, so if you're happy, we'll skip you. We'll go on to Councillor.
I've got another question, Edith.
Okay, all right, then we'll ask you, you can ask the question. Can you, Jocelyn, and then Councillor Agatha Akijina, and then Councillor Omar Bush.
Sorry, just before, Jocelyn, you've accidentally shared your screen. Can you come out of that, please?
I don't know. Yeah, it's okay.
Thank you.
That's okay.
Oh, sorry, I pressed the wrong button. I just wanted to say another question. Thank you for answering about the unions. I just wanted to make a comment about the Black Lives Matter protest that the first councillor spoke about. My concern was, and still is, that the information is not shared widely. So if it can be shared when these protests or the demos are happening, can that be shared? Because it sounds to me like it's been a small group, but it's not shared with the residents. So, for example, in my street and in my block, no one knew that this is happening at the civic center. So, and that is also, how will this be? Is it an email that's been sent or a leaflet when we do something around Black Lives? That's one. And two, I just wanted to ask, is this a BAME firm or is it staff forum? Because there are two different things. How is the staff being? How's this information being shared with the staff? Yeah. So right. Is BAME forum and BAME staff forum two different things? How's the information shared with the staff? Thank you. Thanks, Edith.
Thank you. Councillor Akijina.
Thank you very much, Chair. Thank you for your report, Rachel. I just wanted to know, because you said the forum has got £5,000. How long is that £5,000 for? And what you did say what they're supposed to do, because I find when there's anything to do with BME, the money that's given is quite, to me, is quite a pittance. So I don't really know what they're going to do with that or how long it's going to last for. So if you can let me know how long it's supposed to last, whether they'll be able to get some more to actually do whatever they need to do. Thank you.
Councillor Omar Bush.
Thank you very much. I think my question's already been answered by Rachel with her previous response. I don't really have anything more to add.
Thank you. Councillor Fairclough, did you want to say something? Anthony Fairclough? Are you there?
I am, Chair, but I'm not a member of the panel, so I'm happy to stick my question in the chat.
Okay, you don't. Yeah, Councillor Brenda Fraser.
Thank you. This question probably links to Rachel and oh, I've lost the person, and Liz. Some time ago, I was involved in going out with one of my colleagues to look around the schools about succession planning. It doesn't just matter with what's happening in the schools, but it matters about in the council. And I just wonder if succession planning has actually gone under the carpet, or are you planning to resurrect it, or what are you doing about it? Because that's one of the ways of getting people to move from one position to another. And I cannot see it happening in the council at all.
Thank you, Councillor Fraser. Could you want to answer Rachel and Liz those 3 questions, please?
Yes, I can answer some of them, and again, I'll hand on to Liz for some others as well. So a little bit about how information about events is shared, and some of that is a bit dependent on who's organising the event. Actually, so not all events around Black Lives Matter are organised by the council. So where the council does organise events, it's usually our social media outlets that have promoted those, and I would accept that those don't necessarily reach all people all of the time, but particularly during this COVID period, we've not on the whole been leafleting households for fairly obvious reasons. So mostly council materials get communicated via social media. We have, during the period of lockdown, launched the council's e-newsletter that has several tens of thousands of subscribers and a good readership. But if you're not already a subscriber, I would encourage you, I know the head of comms would be pleased to hear me encourage you to subscribe to that, and then you'll hear of anything that the council is doing. It's obviously more than this work, but that is where council-led initiatives would be found. Agatha, you asked about the £5,000. That is in this administrative year, so it's within this financial year, and it is purely to serve the kind of the meeting and development needs of that BAME forum. And so it's for them to be able to commission a facilitator if they want a facilitator, a trainer, to buy materials and things like that. So on that basis and that expectation, £5,000 is a reasonable sum. It's our intention that it should be possible to replicate that in future years, but of course everything depends to a certain extent on what shape the council's finances are in. But I would have thought a small sum like that would not be very under threat and would be very justifiable for that forum. I realise that I've dodged a question. Sorry, somebody was asking me about the difference between, so as well as the how do we communicate with the wider community, someone was asking about the difference between a BAME forum and a staff forum and how staff got informed. The forum itself is a BAME forum, and it's specifically focused around the needs and issues of those staff. It isn't facilitated by me, so I had a big hand in its relaunch, but it's facilitated by women of colour in the organisation who are heads of service and who have led that piece of work. and it is intentionally a safe space for people to discuss their experience separate from white colleagues. But what has been a heartening part of this process is how much white allyship has been committed, I guess, with colleagues saying, how can I help? I don't want to push in, I don't want to get involved in this forum if it's not for me, but I do want to show that I'm as committed to these aims and objectives as the forum. And so there are opportunities at the forum's request to widen the invitation to include other staff, and all the information about the forum is shared through our internal contacts with all staff. So we have a regular weekly staff bulletin in which this information is shared, and directors speak directly to their own workforces. So my latest webcast to my directorate was on Monday, and this work formed a part of my presentation to my entire workforce, so that whether you were a participant in the BAME forum or not, you would hear about its work and its progress. And that's kind of by popular request, actually, from all members of staff. So Liz, there might be more that you want to say about staff involvement and also about succession planning and talent management, because I know that's very much on your list.
Yes, it certainly is. I mean, it's certainly been on our workforce plan. So yes, we are looking at talent management, succession planning, mentoring and coaching, all with our BAME staff in mind. My learning and development team have been short-staffed up until recently. They are now fully staffed, and we have now got the internal capacity to really motor with this now. So I'm hoping by the next time I come to talk to you, I will be having something a lot more concrete to talk to you about. But this is absolutely in the moment and one of our top priorities. There's a comment in the chat about job data and being able to share the stats around our applicants. Yes, that will be absolutely be one of the items that will be contained in this report that I talked to you about earlier. So we will be sharing that information with you.
I think I'm going to do the last question. Councillor Joan Henry.
Thank you, Chair. This question is for both Liz and Rachel. We have been talking about unconscious bias. I just want to find out, during your role and your engagement within Merton Council, have you ever come across any issue or concern around unconscious bias, and how do you address it? Thank you.
Thank you. That's the last question. Thank you. Rachel, do you want to take that?
It's a hard question to answer, because by definition, if someone's experiencing or enacting unconscious bias, then they may be unaware of it, and others around them may be unaware of it, but it's real nonetheless. So I have to also consider the possibility that I experience it. That I have unconscious biases that I'm not aware of. And part of the training and development in unconscious bias is about me recognising that I may have unconscious biases and seeking to overturn those where they exist. So I find it very difficult to know whether I am experiencing or seeing unconscious bias in action. I find it easier to know when I'm seeing actual racism in action, and although that is not overt very often in the council, I have encountered it a handful of times, and have always been clear to say that I don't like what I'm seeing, and I don't think it's appropriate when I see that. With what may be unconscious bias, it's much harder to read the situation, I find, and so what I tend to notice, I think, is when people's conduct in a meeting or similar kind of social interaction seems to me to create a feeling of tension in the room, actually, and between colleagues. I handle that in various different ways when it arises, but often through commenting as a bystander, but by which I mean saying something like, it seems that there's an unspoken something that has changed the mood of the room, or it feels like there's something that someone needs to get off their chest that hasn't been said, or something like that. So I don't know whether those are the kind of things that you were wanting to ask about, Councillor Henry, but I suppose that's my reflection on my experience of working with diverse colleagues and trying to think really hard about whether what I'm seeing is people being consciously discriminatory or unconsciously biased, or sometimes some people are ruder or unkinder than other people in work situations, and picking through that I find hard. The final thing I suppose I would say is if I have a Black or Asian or other minority colleague that tells me that they have experienced discrimination or a microaggression or any other form of kind of adverse behaviour on the part of their colleagues, I assume that they're right. I assume that they understand the situation better than I do.
Thank you very much, Rachel. Thank you, Rachel and Liz. It's been a very difficult evening, and thank you for all what you have done tonight. It's been quite interesting. The recommendations we have on the paper is that members of the JCC note and comment on the contents of the report. So on a happier note, I would like to say that, we've had Joe Abrams, the late Joe Abrams was the first male Black mayor, and I was the first female Black mayor. And we've had Councillor John Dehaney, Councillor David Chung, Councillor Agatha Akijina, Councillor Brenda Fraser, and Councillor Mercy Skeet, all from the Labour group. We're very proud of what we have done, and we're hoping to celebrate Black History Month, hopefully, and I would like to extend my sincere thanks to all members of the JCC for tonight. Are there any other business? No? If there are no other business, thank you so much to the leader of the council. Oh,
one moment, Chair. One other business. Grace Oyenda, we have just launched a Black Learning Center. Grace, can you open your mic and just explain what it is for us before I go? I'd rather Grace tell you a little bit about it, please.
Good evening, everybody. Thank you for giving me 20 seconds of your time. So Akuta Centre for Learning was launched on the beginning, at the beginning of August. We went initially online digitally due to COVID, supporting children going into year 11 because of the fact that they hadn't had much time to really get a good education with their GCSEs being around the corner. It's been quite successful. We are now opening up the facility to children between the ages of 7 and 16, particularly from a lower social economic background. The material that's been delivered is Maths, English and Black history. The Black history is compulsory and underpinning. So, but it's open to everybody. So we continue from this coming Saturday to children within the Merton community. We are trying to engage as many as possible, to talk to as many parents as possible. I'm happy to put my details on the message, on the chat, so that you can contact us. We have a website, akuta.org.uk. You can register and we can respond those who are interested in registering, as well as those who are interested parties. So that's a little bit about us.
Right, if you can leave your telephone number and Everett will pick it up.
I think it's, sorry, it'd be easier if you email me. I'll send you my email address in the chat. So if you could just email me, it'd be a lot easier. Thank you.
Right. Right. Thank you very much. Thank you so much, everyone, for attending. Thank you to all the speakers and all those who have contributed. Thank you to all members of the JCC, the leader of the council. I'm very grateful to all the councillors who are here tonight. Well done to you all. You're all heroes. Thank you so much for the support which you have given us. It's been absolutely wonderful. And enjoy yourself tonight. Thank you so much.
Thanks, everyone. Okay, then.